Hey guys, welcome back, and today we are going to see and discuss about electrolyte. So what is electrolyte? Electrolyte means minerals. Electrolytes are minerals that give off an electrical charge when they dissolve in body fluids like blood and urine. So electrolytes are minerals. For example, potassium, sodium, calcium, all these are electrolytes. So electrolytes are minerals that give off an electrical charge when they dissolve in body fluids like blood and urine. For example, when you are trying to dissolve a tablet in water, how it will dissolve and how it will give relief to our body. Same way, electrolytes are giving different type of support to our body, and it will be producing a kind of electrical charge or energy when it get dissolved into body fluid like blood and urine. So if there is any imbalance in this minerals level, means that is known as electrolyte imbalance. So what is electrolyte imbalance? It means an imbalance in minerals which is present in our body. It occurs when you have too much or not enough minerals in body. So guys, if it is too much, also electrolyte imbalance. If it is less, that means not enough minerals in our body, also leads to electrolyte imbalance. Once again, I just want to say that electrolytes are minerals like potassium, calcium that give off an electrical charge or energy when they dissolve into the body fluids like urine, blood, etc. From where we get these minerals? Our body makes electrolytes. Our body makes electrolytes, and also we get these minerals from food, drinks, and supplements. So if you're going to doctor for any kind of mineral deficiency, means after diagnosis the doctor will give supplements sometime if it is not producing in the body, but if it is not producing enough. So our body can make electrolytes naturally. Also we get these minerals from food, drinks, and supplements. And now I'll tell you the role of this electrolyte in our body. It will balance body fluids. It will regulate heart rhythm. It will support in muscle functioning, and it will support in nerve functioning. So after reading these things, hope you understand the importance of electrolytes in our body. So electrolyte is playing a major role in the overall functioning of our body. So imbalance sometimes can leads to death also. So now we are going to see the types of electrolytes and what they are doing in the body. Sodium, potassium, calcium, chloride, magnesium, phosphate, bicarbonates are types of electrolyte which is present in our body. So what is sodium is doing? Sodium maintains fluid levels and aids nerves and muscle function. Potassium support heart, nerve, and muscle function, also helps in metabolism. That means to move nutrients into cells and waste products out of them. Calcium. Calcium helps to stabilize blood pressure and also secretes hormones and enzymes for nerve functioning. Next, chloride. Chloride helps to maintain healthy blood levels and body fluids, and also it will helps to maintain blood pressure. Magnesium. Magnesium helps in nerves and muscle function, and it also for the growth of healthy bones and teeth. Phosphate. Phosphate support the nerve and muscles function and also skeletal system maintenance. Bicarbonate helps in pH balance, and bicarbonate also helps to move carbon dioxide, that is a waste product, through bloodstream. So these are all the responsibilities of electrolyte, or what electrolyte is doing in our body means it is doing everything for our body. So imbalance in the electrolyte can lead to severe complications. Now I'll tell you types of higher level of electrolytes. I already told you that if there is higher level of electrolytes, also known as electrolyte imbalance, at the same time less amount of electrolytes also leads to electrolyte imbalance. So now we will see the types of higher level of electrolytes. So if there is a higher level of electrolytes, there are some specific terminologies we will use to say that. If there is higher level of sodium, too much sodium in our body, means that is known as hypernatremia. Hyper is always for increased level. So increased sodium in our body can lead to sodium electrolyte imbalance, and that is known as hypernatremia. Potassium. Increased potassium level in our body is known as hyperkalemia. Calcium. Increased calcium level in our body means that is known as hypercalcemia. Chloride. Increased chloride level in our body means that is known as hyperchloremia. Magnesium. Increased magnesium level means that is hypermagnesemia. Phosphate, hyperphosphatemia, and bicarbonate alkalosis or low alkaline base. So these are all the major type of higher level of electrolytes. If there is increased potassium means we don't say there is an increased level of potassium. We will say hyperkalemia. Medical terminology if we use. Otherwise, we can say increased potassium level. But if you want to write the medical terminology, you have to write that is hyperkalemia. Lower electrolyte types, just opposite to hyper we will use, that is hypo. So sodium hyponatremia, potassium hypokalemia, calcium hypocalcemia, chloride hypochloremia, magnesium hypomagnesemia, phosphate hypophosphatemia, and bicarbonate acidosis. So this is the low electrolytes levels medical terminology. So low or high, whatever it is, that can lead to electrolyte imbalance. Now, what causes an electrolyte imbalance? So, decreased intake of water sometimes can lead to electrolyte imbalance. Not only less water intake, but also certain health condition can also lead to electrolyte imbalance, because our body makes some electrolytes. So, if the body is not functioning properly means there are chances of developing electrolyte imbalance. And also dehydration, decreased water intake also can lead to electrolyte imbalance, because this electrolyte needs to dissolve in body fluids like blood and urine to produce this electrical impulses to function, to helps in the functioning of body. So if there is no proper water intake means there won't be no proper functioning of kidneys and heart and all those stuff, and it can also cause to electrolyte. And what are all the risk factors? And these risk factors also, this listed risk factors also can lead to electrolyte imbalance. Burns, okay, your body parts are burning, okay, burn injuries can lead to electrolyte imbalance. Then as I said, different kind of health condition like cancers, cardiovascular diseases, okay, that can lead to electrolyte imbalance. Then high blood pressure, dehydration, excessive vomiting or diarrhea, excessive sweating, drinking too much water. Here all everywhere water, fluid content, something related to fluid only, all the risk factors, right? So basically decreased amount of fluid in the body or increased amount of fluid in the body can lead to electrolyte imbalance. Then eating disorders, kidney disease, liver disease, substance abuse disorders, certain medications, all can cause to electrolyte imbalance. So these are all the risk factors of electrolyte imbalance. Then how you can identify that you have electrolyte imbalance? Basically, a slight electrolyte imbalance may not cause noticeable change of symptoms in our body, but if you have severe electrolyte imbalance means definitely you can see some symptoms like confusions and irritability. Okay, but all the confusions or irritability is not because of electrolyte imbalance. Confusions and irritability is continuously coming and is disturbing you in all the way means there are chances of electrolyte imbalance. Then diarrhea and constipation. Continuous diarrhea and constipation is a sign of or symptom of electrolyte imbalance. Then fatigue and headache is other symptom of electrolyte imbalance. Then irregular heart rate or arrhythmia, probably a sign of electrolyte imbalance. Muscle spasm or weakness, nausea and vomiting, numbness or tingling in limbs, fingers and toes also considering as the symptoms of electrolyte imbalance. If you have severe electrolyte imbalance, you can see the symptoms. But in slight electrolyte imbalance, you cannot see noticeable changes. Then diagnosis. An electrolyte panel as a part of routine blood test may help to detect this imbalance. So basically when you go to doctor for any kind of complaints like weakness, muscle spasms or diarrhea, fever, sometimes high blood pressure, definitely the doctor will suggest for blood test. This routine blood test will definitely helps to understand the imbalance of minerals, also electrolyte imbalance. Then how we can manage this electrolyte imbalance? Treatment is always depend upon the type of electrolyte imbalance. In minor cases under sometimes treatments are not necessary, but to treat this electrolyte imbalance, basically there are different steps. Okay, so this electrolyte imbalance is because of dehydration, means what the doctor will suggest: drink plenty of water, and also ORS solutions and everything will give to maintain the sodium level and balancing the electrolyte balance. Then if we go to medical treatments, means in severe cases and all, we will go to medical treatments. IV fluids like sodium chloride will what administer, and then IV medicines to restore healthy electrolyte balance, and medications or supplements to replace lost electrolytes, and hemodialysis will do if the patient is having kidney disorder. That is the next level. Okay, in basic cases we will go for IV fluid, IV medicines, medications, supplements, and if it is because of dehydration, means definitely the doctor will make the patient to drink plenty of water as well as ORS solutions to maintain the balance. And then, what is the complication of this electrolyte imbalance? Electrolyte, we had a discussion regarding the importance of electrolyte and also the role of electrolyte in our body, right? It is like it is doing a lot for our body. These minerals are developing an energy in our body when it get dissolved into the body fluids, and it will helps in nerve functioning, muscle functioning, heart functioning. So if there is imbalance, means definitely it can leads to lot of complications, especially especially the whole body functioning will get stopped sometime. Life threatening problems will arise: comas, seizures, sudden cardiac arrest. Okay, and sometimes even death also can happen if it's not treated, and if it's not treating in proper time, means there are chances of even death also, like cardiac arrest and cardiac death can happen. So proper hydration can help your body to maintain a healthy level of electrolyte. That's a simple solution to maintain the electrolyte balance. Drink water, required amount of water. Okay, so again I just want to specifically stress on that word, required amount of water. Then so it's important to drink enough fluids if you experience diarrhea, vomiting and sweating. So excessive sweating, excessive vomiting, excessive diarrhea, and you feel that you are feeling that your body is losing the weight and tiredness, and sweating, means definitely you have to drink water to maintain that balance. But too much drinking also can lead to problems. So this is about electrolyte and electrolyte imbalance. So what is electrolyte? These are all the minerals which is responsible for maintaining the proper functioning of the body. If there is any imbalance in electrolytes level, that means too high or too less, can lead to electrolyte imbalance. Examples for electrolytes are minerals like potassium, calcium, phosphate, chloride, magnesium, etc. So if it's high, it is called hyperkalemia, hypernatremia, hypercalcemia. If it is low, that is called hypokalemia, hyponatremia, hypocalcemia, hypomagnesemia. Okay, alkalosis, acidosis, like that we will call. So if you are not treating it properly, it can lead to a lot of complications. Hope you understand, guys. Thank you.